Hey, Susan.
How are you?
Hey, fine, good. Thank you for putting this on.
Yeah, I hope that it's well attended. I think some people are getting tired of Zoom meetings. So how are y'all doing?
We're fine. Busy at work. Lots of care in the hospital. We have a lot of COVID patients in Murphy.
Yep.
I know they also have it at Union General. I've heard they're busy with it too.
Yeah.
But we are undergoing an outbreak here in Cherokee County.
Yeah.
After reopening and the failure to use best practice by our community.
Mm-hmm.
And so we're seeing the results.
Yeah.
On we go. But we are not exceeding our capacity. We have 2 patients in our ICU, 3 on our medical ward, and we're able to hold our own right now.
Good.
How are you, and how is your family?
Oh, we're doing great. Everybody's still working, so can't complain.
Yeah, that's right. Good.
So I'm outside and it's noisy. So as soon as people start coming on, I will mute myself.
Well, sure.
I'm Mary Leitner. I'm president of PPN, and I'm glad everybody is willing to join us on this Zoom presentation. I must confess, I had not heard of the Dogwood Medical Trust before talking to Brian recently, and was really very interested to learn about what they do as a private organization in terms of providing services to our area. So Betsey Russell is going to be with us tonight making a presentation, and she's the Senior Director of Communications at the Dogwood Health Trust, and she oversees internal and external communications for the foundation. She is an expert in nonprofit branding and communications. As an entrepreneur and consultant for nearly 30 years before joining Dogwood, she was helping foundations express complex concepts to target audiences in a clear way, which is a real talent. In 1996, she created something called Word One, which is the first business in the Southeast devoted exclusively to developing strategic marketing communications for nonprofits and charitable foundations. The firm's award-winning work has delivered superior results for clients like the Center for Rural Strategies, the Southeastern Council of Foundations, and the Atlanta Women's Foundation, and many others. In 2005, Betsey sold Word One and returned to full-time freelancing, moving to Asheville in 2017. So she's a graduate of Davidson College, and she and her husband, Mitch, have 2 teenage boys. So she is our first presenter, and I'll let her go, and then I will talk to, I'll introduce Brian Mitchell, who many of you know.
Thanks, Mary. Brian is gonna tag team a little bit with me on my presentation, so maybe we should let him introduce himself or do an introduction for him also.
Okay, all right. Well, I think most people in PPN know Brian. He has been a supporter of PPN from the very beginning and has made some really excellent presentations in recent years. And he is a board certified internist who's been in practice in Western North Carolina since 1976. He graduated from the University of Pittsburgh medical school in 1974 and specializes in internal medicine. He has a passion for caring for the people of Western North Carolina and for advocating for their well-being. So we're delighted to have Brian here this evening too.
Great, thank you so much. I always think it's funny when people read your bio that you crafted so carefully and then you hear it back and like, oh man, I need to do this well. But thank you guys for taking time on a Sunday afternoon. I'm gonna share my screen and walk you through a presentation about Dogwood Health Trust. And Dogwood Health Trust is a really complex and ever-evolving thing right now, so I won't touch on every aspect of our work, but at least we can focus a little bit and enough to have some conversation. If something comes up and you want to make sure you remember to ask it during the presentation, you can also use that chat feature and just type it in a chat box, and then we can come back and get to it also. So let's see if this works. All right, can everybody see the screen?
Worked for me.
Awesome, great. Okay, so thank you again for having me this afternoon. I am, as Mary said, Betsey Russell. I'm the Senior Director of Communications at Dogwood Health Trust. Just to give you a quick idea of what roles at Dogwood really mean, I also am in charge of our work for the census in the region to support the census count, and I also am the resident czar on COVID-19 testing, which, you know, owning a company that had to do with marketing communications, of course, that's a natural fit, right? But, you know, Dogwood is a lot about adapting to the moment and using your smarts and your connections to get things done, and that's one of the reasons I really love working there. So I wanted to start off with our purpose, which is dedicated to dramatically improving the health and well-being of all people and communities in Western North Carolina. There are a lot of words in that purpose, but there are a couple that I really want to point out to you. I want to point out the word dramatically, because this is not going to be philanthropy as usual. Dogwood is going to be bold. We're going to look for big ways to make a big impact and make a dramatic difference. And we'll talk a little bit about that in a few minutes. Well-being, I wanted to point out, because Dogwood was formed from the sale of a health system, but we are not in a health foundation in that ways you might think of other health foundations that are focused on supporting medical care. Dogwood is really looking upstream at the causes of problems that make people end up needing extra health care. Right? So we're looking upstream at things like, you know, if you think of Maslow's hierarchy, are people living in places that are safe and supportive? Are they getting food? Are they protected from violence? Do they have opportunities for education and a good job and being able to take care of their families? So that's important to us. And this one right here, all people, is important too. Western North Carolina, if you're the rest of the world or the rest of the country, you might look at Western North Carolina and think that's just one type of people and they're all the same. And we all know living here that that is not true. So Dogwood Health Trust is really focused on all people, urban, rural, every county, every background. So let's see. I also would like to tell you really today is going to be 10 things to know about Dogwood Health Trust, but as I kind of mentioned before, there are a lot of things to know about Dogwood Health Trust, and we'll cover as much as we can, but this is just sort of a fun way to help us all keep pace while we're going through this presentation too. So one of the first things you need to know about Dogwood Health Trust is about our commitment and our core values. And these commitments and core values really were developed by our board at the earliest days. So Dogwood was beginning to be developed as early as 2018. And back then, the board met and said, we are absolutely committed to diversity, equity, and inclusion. And we define diversity in a broad way. We define it by geography, by race, by religion, by ability, by sexual orientation, by any kind of thing you can think of. This goes back to that all people that I pointed out in our purpose statement. So we really do take this seriously, and everything that I tell you about today pretty much has an equity goal built into it. So it's something we think about across the board in everything that we do. Our core values are compassion with courage. And by that, I mean, we're going to be really bold. We're going to be courageous in what we do, in fulfilling a commitment to the people and the communities of the region. So we'll do that by taking some smart risks, and we'll invest in some opportunities when we think that they can really deliver some profound impact. So it's exciting work. Partnering with purpose, that means that we're going to sort of foster a collective impact with other organizations in the region. There is no way we could be 10 times bigger than we are, 100 times bigger than we are, and there's no way Dogwood could come into the region and make change by itself. We know that success depends on the work we do with our partners. So we'll do that. We'll promote collaboration among and with partners, and we'll share learning across the region as we do our work so that everybody can kind of learn together and move forward together. And then sustainability with integrity. We really try to be transparent and bring a lot of humility to this work, because these problems are complex and there are many different viewpoints in the region, and there are many different great ideas in the region. And our job first and foremost is to come in and listen and learn and hear from these partners, and then see where we can support and where we can sort of provide that little bit of effort or input that makes a big difference. All right. Our board recently put a name to what it calls its BHAG, which stands for the Big, Hairy, Audacious Goal. And that was, we really want to help create a Western North Carolina where every generation can live, learn, earn, and thrive with dignity and opportunity for all. And when we say all, we mean no exceptions. And we'll get into that a little bit more, that live, learn, earn, and thrive in a minute. So the second thing to know is about our region and our representation. So the map on the screen here shows Dogwood's service area. So the gold area is sort of, where you guys are. The blue area is kind of the middle of the region, and the greenish area is the far eastern part of our region. That's 18 total counties plus the eastern band of Cherokee Indians. And representing that region, we have 13 board members. 5 of those are Black, Indigenous, or people of color. The board members represent 7 counties and the Eastern Band. So in addition to the Eastern Band, we have a board member in Clay County, Donna Tipton Rogers. And on our board, there are 8 women and 5 men. And then in addition to that, we have 16 non-board committee members. And that's the role that Dr. Mitchell plays. And I want to pause just for a second, Dr. Mitchell, and see if you care to say anything about what it means to be a non-board committee member. I think you're on mute.
Yes, can you hear me now?
Yes.
Good, thanks, Betsy. I do want to begin by saying I appreciate Public Policy Network to hold this forum. I think it's going to be a benefit to our region, and certainly a benefit to the Dogwood Trust to have a collaboration, a partnership started with some of the leaders in this area. And thanks to Mary to help this meeting, and thanks to Susan as well. My thanks also to Betsy herself for putting on this great presentation. I appreciate it. Well, I am one of the non-board committee members, and I'm on the Program and Grants Committee. I've been on the committee since January, and we've had meetings at least once a month, and most recently, most of the meetings are on Zoom. We have a very energetic committee, deeply committed to the values of the Dogwood Trust. We are a hardworking committee, and we show up at our meetings prepared and eager to join in the mission of the Trust. It's also part of our effort is to have other meetings during the month to address particular issues that are of importance to the Trust. Jobs, education, healthcare, housing. There's a lot of work to be done, a lot of data to listen to and pass judgment on. The trust has a number of staff members, incredibly well-educated, prepared, brings to our committee very insightful, complete, thorough information for us to consider. The staff are just incredible, from our CEO to Betsey herself. Our CEO is Anthony Chang, to Betsey herself, and to the individuals that are, like Betsey, involved in some of our individual efforts. And it's a challenging and very rewarding opportunity for me. I am privileged to be on the board. I hope I can serve the board well and also this community well. One of the purposes, frankly, is to make sure our community members are represented in the trust, to make sure the trust story is heard in this region. And that's one of the reasons for the Public Policy Network to hear about the trust and to hear it from one of our experts, Betsey.
Thank you, Dr. Mitchell. You're too kind, as always. All right. So how we work. Dr. Mitchell mentioned our CEO, Anthony Chang, and Anthony came to us from across the country in Eastern Washington at a foundation called the Empire Health Foundation. And there he sort of coined this phrase, Philanthropy 3.0, and started working in a way that we now call Philanthropy 3.0. And there's some things about Philanthropy 3.0 that are different from foundations that I certainly worked with in my 30 years in the field, and with foundations that most people think of. And the simplest way to describe it is that Dogwood is sort of partner first and funder second. So we don't lead with the money. A lot of foundations practice what Anthony calls Philanthropy 1.0, which is basically responsive funding, right? You send in a request, they just sort of take what comes over the transoms, figured out what maybe they want to fund, write a check, give it back. And then there's some foundations who are a little bit more sort of focused. They may have a particular program that they really believe in that they want to fund, or an approach, or a theory of change. And they basically say, we're interested in this. And if you're interested in this too, then we will give you some funds, and then we'll make you do a whole lot of paperwork to prove that you think how we think. I'm being a little harsh to some of my colleagues, but Philanthropy 3.0, though, is a little bit different. And that is Philanthropy 3.0, we really want to sort of make sure that we are really making change, that our investments are really delivering return for the community. And I don't think financial return, I'm talking about real change, systems change. So one of the things about Philanthropy 3.0 that sets it apart from other philanthropies is that we really do look for specific indicators that we believe, if we address them, will help to change the broader outcome. So these are things which we'll work on with our partners, and we want to be able to move the needle in those particular things. So for example, I'm sure everyone has heard about the achievement gap in Asheville City schools. It's like, I think, one of the 5th worst in the nation and the worst in the state, maybe. So, you know, moving the needle would mean closing that achievement gap by X% over a certain number of months or years. And then be able to show some clear return. Like, did we hit, this is a solid goal, did we hit it or not? Philanthropy 3.0 also really learns from what we call bright spots. And these are things that are happening in other parts of the country or other parts of the world, or in our region, in one part of our region, that we can bring to bear in other locations. So we want to learn a lot from these bright spots, figure out where people are addressing change, or addressing needs and making change successfully, and study these examples. And it's probably not super likely that we would just bring them in and just flat out replicate them. We'd probably adapt them so that they fit the players in our own communities and adjust and fit the needs and move the needles that we want to move more successfully. So that's how we sort of bring in knowledge from other places. So we do like to research, we do like to learn. we really share responsibility and accountability. We really build shared ownership with partners. So instead of our partner saying, hey, I think we should fund this, and us saying, well, maybe this bright spot would work, and it's an either or situation, it's the beginning of a conversation. And then we talk more, and then we talk some more, and we figure it out, and we build something together. And then we're both co-invested in it. And then we'll sort of use our mutually created goals to make sure that we're measuring our performance on a regular basis. And we really do engage deeply with our partners, and we hold ourselves accountable. Actually, if you're on the impact side, or what's known as like typically called the program side in Dogwood Health Trust, your performance review as an employee will depend a lot on how your actual partners are doing in the field and how those shared goals are being met. We hold ourselves just as accountable as our partners, or more so. We really want to be able to make course corrections in real time. So rather than waiting until like, oh, here's the grant period was a year. Okay, it's a year. Give us your report. Oh, it didn't work so well. Too bad. You messed up. Instead, we really check in all the time. So we want to make sure that we're checking in, and if there is a course correction that needs to be made because something's not going well, then we want to work with our partners to figure out what might work better, and then kind of put our attentions to that. If we're doing something and outcomes are going great, then we might double down and say, you know what, this is going so well, we want to do even more. Remind me when we get to the part about the census, and I'll give an example about that. And then we really want to pay attention to how systems intertwine, because we know if we are trying to be bold and make significant systems change in one area, we might affect another one. So for example, if we were able to really pull in some high-paying jobs and sort of increase the wages and all that kind of stuff, that would be great, but it might also really raise housing prices even more than they already are in our region. So that might affect some folks negatively. So we just have to pay attention to how all these things intertwine and know that when we push on one, we might be pulling on another. And then really we move beyond check writing. And I'm happy to say that making grants is always been a stock and trade for foundations, but over the last few years, there have been more and more tools that bold funders have figured out how to use. So these are things like, you might hear us talk about impact investments. So in a nutshell, for the way private foundations works, typically you have to give away 5% roughly, there's some variations on that, but roughly 5% of grant funds of your income from your endowment in grant funds. So that's great. That's how you write checks. That's how you protect your endowment so that it's there for perpetuity, so you can continue to invest in the community in the ways that need to be invested in. But you can also use some of your endowment as a foundation to make investments where you can, sort of provide that bit of seed capital or a little bit of bridge funding or something like that, and then get a return on your investment endowment that way. Your endowment investment that way. So that's how we can move beyond check writing. It's not just about writing checks and sending them out the door. It's about co-investment, and I'll talk about that in a minute as well. So kind of summing it all up, it's really about changing systems, about understanding if people are hungry, let's not just figure out how to feed them. Let's figure out how to change the food system so that we can get them food. If people don't have housing they can afford, well, then let's figure out how to work with the system, change the system so that housing becomes more affordable. And our kind of motto is sort of whatever it takes. Once we've committed to a goal and committed to a metric, we'll really do whatever it takes to get there. Okay. So Dr. Mitchell mentioned some strategic priorities for Dogwood, and those are housing, education, jobs, and healthcare access. Now, these 4 strategic priorities, our board had decided on those priorities, and we were getting ready to have this great 2-day retreat at the end of March and hash them all out and figure out what the goals were going to be, what those metrics were going to be, what needles we were going to move, all that kind of stuff. And then COVID. So we just now are getting back into the groove of putting some wheels on each of these 4 things, and I'll talk about a couple of them in a minute. But before that, I want to talk about the but also that you see on this slide here, the other things that we have been doing. When Dogwood was formed, one of the first things we agreed to do and chose to invest in was to put $25 million into substance use disorder in the region, opioids, but also other substance abuse issues. That's $5 million over a year, over 5 years. And we've done things in that arena, like provided naloxone to different organizations. We even tried a little pilot to see if people would order free naloxone that could be delivered directly to their home. We've done some medication assistance, medication-assisted treatment work, and then we've also done some strategic sort of needle exchange placement and things like that. So we've done some work in that area. And then we have the Leverage Fund, which is so far spent about $500,000 to bring about $7 million in other funding into the region. Now, why do we do that? Dogwood is a $1.5 billion foundation. But as I said before, we could spend all of our money tomorrow in the region and not solve all these problems. And there's so much more money, especially when you're thinking about federally funded programs, some state programs. So what we do is help organizations in the region apply for those grant funds. I don't know if any of you have ever applied for a federal grant before, but the applications can be this thick and really sort of purposefully written to be confusing, it seems like sometimes. So we will pair organizations with professional grant writers who have a track record for that particular agency. So if you want to apply for USDA funding or HRSA funding or something like that, we'll find a grant writer who really knows their stuff and has a high win rate, and then combine folks with those grant writers to really bring in that money. So that's the Leverage Fund. And then ION grants we did in January, and just had made the decision in March, which was really fortuitous. ION grants stand for Immediate Opportunities and Need Grants. And this was a way for us to get some money out to smaller organizations in the region. It was a way for us to kind of learn a little bit more about who was out there and what they were doing and what they needed. And ION grants were for things like needs, like I desperately need a refrigerator for my food pantry, or I need a vehicle so that I can do transportation for folks, or opportunities like I really want to get a solid strategic plan down and now's the best time to do it, or I need to invest in IT because all my computers are falling apart. So we opened that up. The board approved $2.5 million for ION grants. We received like over close to 500, 492 applicants. We ended up awarding 259 awards. These were grants of $500,000 to $25,000, and our board chose to up what we were investing because of the compelling nature of all the applications. So we awarded $3.7 million in ION grants, and they were very diverse across. We made sure they were in every county in the region and the Eastern Band, and all different kinds of organizations. And, it was great to him to sort of give this money out to help folks. It was a 1.0 type strategy, but what it really did for us was gave us a much deeper knowledge about organizations in the region and our relationships with them. And some of those ION recipients have now started to become partners in our other work as well. Healthy Opportunities, I don't know if any of you know about that. That was a program from the state. The state issued a big RFP back in November, I think. And it was supposed to bring, it could have brought about 200 million to our region. And what it would do is it would sort of expand Medicaid and a pilot program so that providers who provided funding for domestic violence services or sort of violence services, transportation, housing, food security, they could basically bill Medicaid for their services. And then they would all be sort of coordinated by the state so that they'd have some case management around it. So that we turned in that 900 something page application response back in February. And then understandably, there's been no decision by the state on that. They've sort of tabled it because of COVID-19. But we're still hopeful that that could happen. And our senior staff had experience in responding to that kind of state giant contract before, managing it, doing all that kind of stuff. So Dogwood played the role of what's called the lead pilot entity. So basically we'd be coordinating it for the region. Racial equity. Our board recently approved a little over $5 million to address racial equity issues throughout the region. And this was in response to sort of the movement that's cropped up and become stronger because of George Floyd. And we have a statement on our website that I urge you all to go look at, because there were a lot of organizations, I think, that responded quickly to what was going on in the world and in our area here and posted statements, and they're great. But we actually we brought our board together, we brought our staff together, and we talked in different groups for about 2 weeks to say, we all know this is wrong. We all know we want to do something about it. What are we going to do about it? And in our statement, we make some commitments to racial equity, which I urge you to read online. But it's really going to be a lot of investing in organizations that are sort of led by people of color, and that really serve communities of color, a lot of racial justice kind of work. And that's just getting started. So there's not a lot of concrete information I can give you about it, but the commitment is absolutely there. And I do urge you to check out the statement on our website. And then the census. So as I mentioned before, I am in charge of our census strategy, and I would probably go way deep, and I'm happy to do that after this overall presentation. We can talk more about census, but the important thing to know here is that every individual who fills out the census in North Carolina is worth about $4,000 a year, or $40,000 over a decade in federal and some state funding in our region. And our region has historically been the bottom 20% of performance throughout the nation when it comes to responding to the census. So for us, this is one of those areas where, like, let's be bold and let's make sure that we don't leave tens of billions of dollars on the table that could be coming to our region. So with our census work, we did a massive ad campaign all across the region. You might have seen some of it. It says "We Count." It's sort of a pink and blue sort of palette with people on there. There's billboards, there's print ads, there's radio spots, there's pop-ups if you're watching Hulu. A lot of money in advertising. And then we're providing incentives to counties. So every county that increases its self-response rate by a full point gets $1,000 per point. And we just upped that in August to $2,000 per point. So this is an example of that adjusting as things change, because the census was supposed to end October 31st, but now it's going to end September 30th. So we doubled down, $2,000 a point for counties for every point they increase. One-time $5,000 reward for counties who surpass their 2010 response rate. And I think Cherokee County just did that. And we're also working with nonprofit partners to actually pick up the phone, call their networks, or safely reach out to folks that they have in their networks, ask them if they've completed the census. If they haven't, walk them through it right then. And then we're giving them $10 a head, but now $20 a head for every individual that they count in the census. So again, happy to talk about that more after, but I could talk about census all day. All right. So housing is one of those 4 buckets that Dr. Mitchell mentioned. And our board recently awarded allocated $5.68 million for us to get engaged in starting of 500 affordable housing units. That's the first step in a bigger vision where we're hoping to do, like, this is not all board approved yet, but hoping to do 5,000 to 10,000 units over the next 5 to 10 years. Because affordable housing is in such short supply, I know in your counties, probably in most counties in the region, there hasn't been affordable housing built in decades. It's kind of alarming. So we're going to be supporting kind of this pre-development of affordable housing sites. There's like all this site work that goes in and prep and all this kind of stuff. We'll be helping to build the new units as sort of a financer or entity. And then we're going to help preserve affordable units that are in jeopardy right now. So this is where we talk about more than writing a check. We're going to be playing the role of a bridge funder for some construction bridge funding, a loan guarantor if necessary to help people access some low-income tax stuff that I confess I don't really understand because I don't work directly in housing. And then we can be an equity partner in some of these too. So we may actually own a stake in some. And another part of the board's kind of vision for the region is that Dogwood, as we're reaching out into different communities in the region, we might create some type of development where there's affordable housing and there's a daycare center and there's a market with maybe local produce and there's, you know, and a Dogwood sort of office there too. So that's kind of how our housing is shaping up. But like I said, we're just getting started and figuring out some of this. But that's an exciting thing to consider. And then jobs and employment, we just made an investment allocation for $10.25 million. And this is to really sort of not only add new jobs, but protect the ones that were already here that were hit by COVID too. So we really want to retain or catalyze at least 5,000 jobs. And then we really want to make sure our economy is diversified because we got hit hard because of tourism. And you know, anyone probably could have seen that coming. So we'll play the same roles we would play in housing, where we're a bridge funder, or we guarantee some loans for folks, or we actually serve as an equity partner. We did, during COVID-19, provide about $9 million in bridge funding so that people could get PPP loans and not have to wait for the SBA to come through on those loans. And now I think our total investment in PPP is up to $13 million. We'll also try to attract and expand companies in Western North Carolina. I'll talk about this more during in a minute, about a little more in depth about COVID, but we are working with some companies in the region to step up their production of PPE manufacturing and COVID-19 testing and COVID-19 testing availability in the region. So we'll be doing stuff for, those are the kind of the board approved investment allocations for housing and jobs and employment. We haven't quite gotten our education goals yet, but I think that one's next up. So, but I wanted to give you just some examples of how we think about education, right? So we might say, okay, we want to make sure that across the region, X% of children are K-ready, kindergarten ready when they enter. So we'll make an investment in early ed somehow to make that happen. Or we may want to close the racial achievement gap, like I mentioned before, by a certain percent, or increase high school graduation rates by a certain percent, or increase the percentage of kids who are, you know, going to college or completing college or going to community college. So we're kind of really committed to earliest to latest, but we just have not yet had a chance to figure all that out yet. And then our strategies today really have been mostly about COVID. So we did do some mobile hotspots for remote learning. They're called Kahoot. That's what it is, or something like that. Not Kahoot. I can't think of the name. Anyway, Khajiit hotspots. That was it. Khajiit hotspots on buses. We also provided some home hotspots for high school seniors who really needed to graduate and for teachers who really needed to teach. We've also provided some cleaning supplies and some infrared thermometers for early childcare centers so they can open up. And then we're trying to figure out sort of work on a pilot right now to support some higher ed reopening. So that's kind of potentially in the works. And then, why does my thing not want to, there we go. All right, and healthcare access is another one of our 4 pillars. And again, this isn't actually the provision of clinical care itself, but actually making sure that people who have not had access to it in the past have access to it. So that might look like something that supports and I'm making this up, so don't hold me to this, but something that might support like the placement of caregivers, primary caregivers in more locations throughout the region, or increasing the access to, I don't know, vaccines maybe, like a COVID vaccine if one ever shows up. And we've done this too, like we've provided testing for the region for COVID-19. We'll talk about that in a second. And this is why we have not yet done as much on the 4 big pillars as we wanted because COVID. This is kind of now how I answer every question. Hey, how's it going? Yeah, COVID. So Dogwood allocated $10 million to COVID-19 response. And I will add that I actually started full-time at Dogwood in April. I was working as a contractor before then. I've actually never had a desk at the Dogwood office or an office because we all went home, right? But we had 5 strategies. So one of them for COVID is to reduce transmission and sort of flatten the curve, right? Keep people from getting sick. So we did things like at the beginning of the COVID pandemic, the state lab, I think, was able to, or Department of Health was maybe able to give like 3 tests a week to health departments in this part of the state. They just, no one saw it coming. So I'm not criticizing them at all, but, and if I were in charge and people were getting sick in great numbers in Raleigh and Charlotte, I would direct my resources there as well. But that kind of left us without what we needed here. So I spent a little time sourcing what ended up being about 2,500 test kits for the region. And I want to take a minute here to talk about what that looks like. What does it mean if Dogwood is essentially purchasing tests, getting them shipped here, and then handing them out to health departments? Our goal was to do contact tracing, because that's a key part of stopping the spread. You test someone and they're sick, then you have to figure out who else they've been in contact with and go test those people, or unless it just sort of spreads, right? So our first and best partner in all of this for contact tracing has been Dr. Mitchell and the Cherokee County Health Department. So Dr. Mitchell, I'm going to invite you to step in too and talk a little bit about what you guys did with these tests and how it worked in Cherokee County.
Good. Yeah, thank you. Let me see if am I okay? Can you hear me?
Mm-hmm.
Yes.
Thanks. Yes, thank you, Betsy. Yeah, I want to tell you the story about the folk school and the assistance the Dogwood Trust gave to the folk school at the beginning of the COVID epidemic. It was March 10th. There was a dance at the folk school attended by 75 or so people, one of whom was a visitor from an out-of-state source, and that person got sick the following day after the dance, was tested for COVID, and her test results returned a week later as positive. So on March 18th, I believe, the folk school was notified about the potential source and notified the community, particularly the dance community, of the potential for COVID to strike the group that was at the dance. The next day, I think it was on the 19th, I was in touch with the Dogwood Trust because I knew they were committed to mitigating the spread of the COVID and had resources to help with testing and tracing. And the following day, on the 20th, is when I began discussions with Betsy and the leadership of the Dogwood Trust. And that was followed by some intense and ultimately successful discussions with our health departments in Cherokee and Clay County. And so that was the weekend of the 21st. By Monday, we received 500 test kits from Dogwood to begin testing the dancers at the folk school. The following morning on Tuesday, this was a week after this person had been notified of her positive test results, we tested 75 people in the festival barn at the folk school. Myself, members of the Clay and Cherokee health departments, as well as 2 employees of MAHEC, 2 nurses from the school systems that came to help us. And so one after the other, the cars drove through the festival barn, paper were filled out, testing was done. All of these folks were advised to stay isolated until the test results returned. A week later, it was a slow return. It was somewhat disappointed we didn't get faster return, but we did. Of the 75 tests, we had 6 positives. Those were individuals from Clay and Cherokee County. I think there was 1 individual from North Georgia. They were all notified. Contact tracing of their contacts were done. And all of those were retested by the health departments, ultimately were found to be okay. No one of the 6 were, at the time of testing, symptomatic. A few became symptomatic thereafter. Their illness was mild. There were no subsequent outbreaks among those that were tested, and we felt like we controlled the outbreak at the folk school. We found that a number of lessons. We found that rural spread of COVID occurs. We found that asymptomatic patients are tested positive. Asymptomatic spread occurs. We found that testing works to uncover those who are positive. And we feel, after looking at the subsequent reduction or in the outbreak in the Brasstown community, that outbreaks can certainly be stopped. So another one of the lessons is that we saw the benefit of what the Dogwood Trust can do in terms of partnering. They partnered with the folk school, with the local health community, myself, with the health departments, and made for a successful outcome in our community. We also found that
Uh-oh, where'd he go?
sorry, did you miss me there?
Yeah.
Just
Okay, I'm sorry. I think there was an incoming phone call. Well, we found that Dogwood has the resources to provide immediate and sufficient support for testing and contact tracing, and that their collaboration with the health departments continued after that. They supported subsequent testing and tracing of potential outbreaks in 2 of our nursing homes, one in Clay and one in Cherokee County. So it was a clear indication to me and to many of those in Brasstown and our communities that Dogwood has a great, it has a great ability to work to help the wellness of the citizens of our region. They are skilled, they have the resources, they're dedicated to working. My experience with the Dogwood at that time convinced me that these folks have a great mission that we should appreciate and be grateful for. Also, I would add, from my own personal view about our community, I think the folk school and the community in Brasstown responded perfectly well, like good citizens should. They understood to protect themselves and their community, they had to be tested. And they did so, and they should be credited with a great response to a threat to them and their community.
Absolutely. Thank you, Dr. Mitchell.
I might add, it was my first experience working with Betsey, and she was right on top of her game, helping those first few days of getting us our testing supplies, getting the cooperation of our health departments, getting the staff that we needed to do the testing, thanks to Betsey as well.
Thank you. I really think it was your leadership, though, Dr. Mitchell, out in Cherokee County that actually brought it all together. I will say that COVID has been a great example for me of how Dogwood Health Trust really works, because we don't have any medical people on our staff. We don't have anyone who's especially knowledgeable about testing. I had not met any of the health directors in the region, although I know them all now. And we don't have anyone who knew about PPE manufacturing or any of this kind of stuff, but that's what was needed, so that's where we went. I'm going to run through our PPE like really quickly. We did a big media campaign about staying home at first, and we've done another one more recently about wearing masks. And then we've also helped we secured about $3 million worth of PPE, some produced locally, some from China, and distributed it. This is our PPE team here distributing to Western Carolina Medical Society. And then like I said, we worked with some local companies like Kitspo, which is a bicycle apparel manufacturer in Old Fort, and with cultivated cocktails to sort of shift their production into things COVID related. So Kidspo started making masks, cloth masks, and cultivated cocktails, made hand sanitizer, and we distributed all of those kind of things. And then worked with other partners too. This is a group called ABIPA, delivering care packages to seniors. This is a testing site in Henderson County, specifically for Latinx community members. And this is a strike team for senior, it's not a great name, but I didn't come up with it. But our senior strike team that goes in when there's a nursing home outbreak and really helps the folks at the nursing home get it under control and protect everybody quickly. So those are some of the kind of things that we did in response to COVID-19. We also, as I said, supported schools with the Wi-Fi hotspots. We supported some food distribution through WNC Communities, which is really active in the western part of the state, I know. Lots of processed chicken from the eastern part of the state, lots of live hogs from the eastern part of the state. I didn't know a lot of people had the capacity to butcher their own live hogs right now, but apparently several hundred have come in from the eastern part of the state. We also collaborated with other funders because, like I said, we're not in this alone, and there's no one right answer for responding to COVID. And this is one of those situations where just putting some money in there for people helps. So we shout out to WNC Community Foundation Emergency Response Fund. We contributed to that. And then we also helped purchase some laptops for the United Way so they could expand their 211 system. And then we did some bridge funding. And this is, again, that role beyond the check kind of role. So we partnered with Mountain BizWorks, and we sort of made sure that we had covered some bridge funding so that smaller organizations could get some PPP loans. And that would be like, small rural organizations, women-led organizations, minority-led organizations. And then we also invested $2 million in the NC Rural Center Rapid Recovery Fund in partnership with Golden Leaf. So a lot. I feel like I just did 4 or 5 months worth of COVID response in just a little bit of time, but a lot, and it still goes on. We now have access to another 15,000 tests for uninsured folks that we can activate if needed, and actually sending some to Cherokee and Clay and Graham County. I think have all already signed up for those, so good to know. And then probably the last thing to know about us, and the most important, is that we really are just getting started. Like, we became a real foundation official at the beginning of 2019. Our CEO didn't get here until October of last year. We were planning our lovely roadway with our steps forward, and then COVID sort of blew everything asunder, and now we're kind of getting back on there, and who knows what'll come next. But we are, our CEO has put hundreds of miles behind the windshield before COVID and hundreds of hours on Zoom, getting to know people all across the region. We're still really interested in that. So if you have a group or an organization that would like to learn more or talk directly with him, just let me know. We are really definitely looking for partners and for great ideas, especially in those 4 buckets. And really would love to hear from you. Like, we mean it. We really like to know who's out in the region, who's doing what, and kind of everything that there is to learn about you and your community and what's going on. So we really, when we say we would love to hear from you, we mean it. So that's it. I have a little Q&A time, and I'm going to stop sharing my screen. I feel like I've talked a lot, and I'm sure you guys have questions. So.
Wonderful.
If you'd like to ask a question or make a comment, just unmute yourself. That's at the bottom left-hand side of your screen. And I did just want to say that out here, the biggest problem that I personally experience is the lack of broadband. So I was very excited to see the expansion of broadband as a high priority.
It is a priority. I can't tell you what we're doing with that yet. We're still in this sort of figuring out what's available, where the opportunities are phase. So, and who is actually already doing the work too in particular parts of the region. So if there's an organizations that you guys know of that are really sort of taking the lead of broadband in your area, let me know, please. And I'll forward it to our broadband jobs folks. Somebody just asked me to put my email in the chat, doing that right now.
Mm-hmm.
You're muted.
Mary, you're muted if you're trying to talk.
Sorry about that. I was saying I wish that your geographic area extended into Northeast Georgia.
Yes, unfortunately, we've got to draw the line somewhere.
Well, on the bright side, if things improve out here, then that'll increase competition and pressure in Georgia.
That's true. That's true. Yeah.
Can I ask a question?
Yeah, please.
I don't know how you're going to recognize this. Hi, my name is Alex. I'm on PPN also, and I have to tell you, you couldn't have found a more spectacular ambassador for Cherokee County than Dr. Brian Mitchell.
I believe
He is our healthcare hero. We just adore him. I'm so grateful for all that he's done and that you guys have linked up. I've been a funder in the public sector and working with foundations in South Florida for, gosh, over 35 years of my career. And I wanted to say how inspiring your presentation was, first off, that the idea of Philanthropy 3.0 is just a genius idea. And in part, now this is based on all of like 7 years living in the community now as a retiree in Western North Carolina. I think it's going to take homegrown solutions, but it's possible to introduce bright spots. But what we really need are those community leaders like Dr. Mitchell who inspire people to come to the table. Opioids has been a huge focus of all of us on the PPN side. Even though we have small numbers, you've probably seen the data that shows like Cherokee County's up there in the top 100 counties that people have identified for risks in opioid. We were very fortunate to have the Cherokee County Sheriff on a panel last fall, along with one of the bright spots that happens to be in Northeast Georgia. They have a regional drug court. And one of our members invited the administrator to come and talk about how that works. And our sheriff was really excited about it. Now, there are other drug courts in major metropolitan areas of North Carolina, but out here, it's like, how can we bring people to the table to make it work? It was clear that our sheriff is very much involved regionally with other sheriffs and definitely receptive. I had personally witnessed him telling our county commissioners, don't give us more money for law enforcement. We need treatment. We need innovation. We need something to stop arresting the same people and over and over again. And when the administrator spoke for Northeast Georgia, it's clear that there's more than 20 years of experience with the drug courts. And we just really seem to need to bring people to the table to be creative and make that happen. I believe she said, and Mary was there, I believe she said they had better than 50% were not reoffending, because obviously the consequences are gigantic if they do fail to stay clean and sober, employed in treatment or aftercare, excuse me. They actually have to go face the consequences of incarceration. So it's a thrilling idea, and if there's any way you all could be part of bringing the right folks to the table, I do believe our Cherokee County Sheriff would be ready to be there with you. I really do.
Yeah. Would you send, I put my email in the chat so anybody can send me any suggestions or questions that you have too offline, but if you'd send me his information, that would be great. And I can forward it to our substance abuse disorder folks. I think I failed to mention that our goal is to reduce substance abuse or opioid deaths by 40%. So, yeah.
Well, we were really pleased that as a result of that meeting, he asked the court administrator here in Blairsville to present to his county commissioners, and just in the hopes of starting something there.
Yeah.
So we felt really good about having brought them together. And I believe that I think that was one of the presentations that we got on video. So it's on our website under events if you're interested.
Great.
I'm going
What you're
to
saying.
jump
I
in.
noticed in one of your last slides, you said you would be convening stakeholders. I think if you pull together stakeholders around opioids in Clay and Cherokee County, you'd have some terrific participation. I do.
Okay, great.
Judith, did you have a question?
I would just like to think about the Dogwood Trust helping with the newly underemployed, the long-term unemployed. Although I understand funding from the state for Medicaid expansion has not passed yet. But the Affordable Care Act, people have no real access or publicity about, you may qualify now for sign up now. In Clay and Cherokee County, there are no assisters to help at this time, although you can use the phone number of Mountain Bridges, I believe it's called, the nonprofit. I'm getting the name wrong, but I think in terms of leveraging funds, we need more information and access to getting people who do qualify for the affordable care, because everyone's income is changing right now. And those who made enough to afford it or made too much to get a good subsidy, they may qualify for a subsidy now because their incomes has dropped and there is no information getting out there in this region at all.
Does Pisgah Legal Services have locations in your county?
No, it's not Pisgah, it's Mountain Projects that has been doing the outreach in our county, and it's limited by their limitations. So Pisgah Legal has not come to Cherokee or Clay County at all with the affordable care. It's been Mountain Projects, and we need a more vibrant visibility in these counties.
Right. All right.
And
Mountain
that would be very helpful in multiplying the dollars, because every person who does qualify then gets health care and and payment is done. I'm sorry, I'm stuttering a little this afternoon. So that's a resource that can build 3.0, that we leverage what is already there, and it's not happening at all.
One of the things that we're, I took down the name of Mountain Projects to look into that some more and give that to our folks who are working on, one of the things we're kind of exploring is a sort of a technology solution, so that, and I can't tell you exactly what it would look like, but basically it would allow you to sign up for ACA, for SNAP, for all kinds of other benefits in one place and hopefully on your phone. And then it would connect the people who are providing those benefits, the local, like Pisgah Legal and Mountain Projects and those kind of folks, so that they have a better streamlined understanding of who's getting what from where, and just sort of making it a whole lot simpler for the end user, and a lot more data rich environment for the providers, so that, you know, the more they know, the better they can do, and the easier it is for you to get your benefits, the better you are. So we are working on that.
Thank you.
Yeah.
Hi, can you hear me? This is Cindy Soulsby. Can you hear me?
Yes.
Yeah.
Oh, hi. I'm from Mountain Projects.
Great.
And yeah, and we do, I work in Macon County. I'm a healthcare navigator. And this lady was exactly right. We can sign people up now who fall in the Medicaid gap previously. And now people that get, you know, they're getting the unemployment benefits, that's pushing them over the edge. So we can get them in. Recently, I know that I've signed up at least 5 or 6 people just in the last couple of weeks for that reason alone. They're making more money now. So, and we had a lady that had quit, but she's come back and she covers Cherokee and Clay now. And that's Linda Curtis. And should I give you her phone number? I don't know if they wanted. I could put it in the chat. I could write it in the chat, I guess.
Yeah, that'd be great.
Okay, yeah. So she's back and she's raring to go. She's got offices in Cherokee and Clay County. So, I
Great.
just, yeah. So thank you for mentioning that. I appreciate it. Because it is important that we can get, a lot of people don't realize that there is that Medicaid gap special enrollment. And when you call the marketplace, they don't know about it either. I mean, it's really unbelievable. But we have a special portal now that we go through to enroll people, and it's goes in very fast. So
Uh,
yeah,
Can I
thank
address
you.
affordable housing? We're Andrews Valley Initiative, and we're in Andrews, and we have started a public-private partnership and for affordable housing in our town with local investors. And we built our site out, and we built the first house. Local banks are not very excited about bridge financing us, and we certainly would like to have Dogwood Trust take a look at our project and see whether there's any interest in working with us, because we built the first house, sold it before it was completed, but we're not getting any cooperation from any local banks to work with us on bridge financing. Thought maybe you could help.
I saw your comment in the chat. Bob, will you email me information about that project separately? And then I can share that with the housing team.
Okay. Are you going to let us download those slides so we have them all?
I sent them. So I think I sent them to Susan.
Okay.
So yeah, she can share them.
Thank you.
Sure.
We'll put them on the PPN website.
Thank you.
Could I double dip, I guess they call it. In the very earliest months of PPN's existence, Judith Wickstrom, who's on this call, worked with the founders of PPN and Dr. Mitchell to have a town hall on affordable healthcare. That, at that point, the ACA was under attack. There's a lot of concern about it. And I wasn't present, but I remember hearing this. Judith left me with this thought when I first met her, that there were people that went to the microphone and didn't understand that if Affordable Care Act was somehow defunded, it was going to affect them. They said, "Oh, I'm okay. My family finally has insurance. We have Obamacare." And they really, they didn't really understand that. And I maybe because I've worked in large metropolitan areas, I was really startled to realize that it's almost like the level of health literacy in our area is pretty low, or maybe it's just that the complication of federal regulations that we're talking about, it's alienating to people. You know what I mean? You should not need to have a PhD to apply for health insurance. And we also are really strained to have enough navigators, as Judith said, to do this job. So I know that's a very broad goal to talk about health literacy, but I guess I would put that out there as maybe another thing for where the foundation could have a goal over the next 10 years to really empower people to feel they can improve outcomes for themselves and their family. I feel like that's been one of our challenges with COVID in the first 3 months of seeing so few people willing to adopt the masks. As people honestly saw this as a political issue and not a public health issue. So, there's just been a lot of polarization out here, and maybe other parts of North Carolina too, I don't know, but, just telling you from what I saw here.
Unfortunately, I think that polarization is everywhere. And no, as I sort of mentioned, I sort of blew through the health access to healthcare slide because we are still just getting started and thinking through strategies there. So I'll definitely bring that health literacy message to that team as well. This is exactly, and you guys have tons of great ideas. And so it's kind of fun. I get to now connect the dots with our staff. So, any other questions or ideas or?
What are your plans in the area of healthcare? Because since PPN began, that's always been a strong area of interest and activity for us. What do you envision?
So I can't really answer the question because we're just, like I said, we're just kind of getting started in terms of what health access, our access to healthcare work is going to look like, and sort of what those goals are going to be. So I do know that, you know, whatever we do, we try to sort of make sure it covers the entire region, or has, you know, so we might have a pilot in Western North Carolina and another one in Eastern part of this, or in the Western counties, and one in our Eastern part of our region, and try different things. But we want to make sure that we touch everywhere. And we'll probably do a lot of different sort of come at the elephant from different directions, but I can't tell you yet what that is.
Okay.
We're
Yeah,
still under development, right?
Okay. We also had 2 programs with different areas of emphasis on alternative medicine and medical cannabis, and you know, how that could be used to reduce addiction, you know, to opioids, and to meet the needs of, you know, people with chronic pain. So we've also got that on our website under events. So we got a lot of participation and interest from the community.
I will, I'll make sure that I point those resources on your website, point those out to our health access team, because it sounds like there's a lot of good stuff there.
Okay.
Funding in minority communities to bring them into the service delivery. This was in New York State in child welfare, where the vast majority of the kids were from Black and Hispanic communities, but we had very few nonprofits at that time that were actually engaged in family preservation and then family reunification. We began to make grants to these nonprofits. Some of them had spun off of churches that were involved in trying to find adoptive families for kids in the foster care system. And what we found is they really needed an investment in capacity building, like actually what is the work of running a nonprofit. There was nothing sadder for me than the day that the Association of Black Social Workers in New York City had to give back a grant to us because they hadn't grasped what they had to pay their taxes, you know, their payroll taxes. Talk about a hot button issue today. But that was a really sad thing. Our state controller forbid us to give them any additional grant money because they owed almost $100,000 in taxes over the years of our grant making to them. So that actually became a sideline of my work as a funder in both the public sector and the nonprofit, was how could we make sure that these folks are successful, not only in meeting the programmatic goals, but in actually administering the funds, building strong, viable boards, having succession planning for their new executive directors, that kind of thing. I think it might fit into one of your goals for doing work around racial inequalities. It's almost like, you know, helping build the business side of the nonprofit community. It's just something to plan in your mind. I have samples I can give you of work that I know has been done in New York State, in Miami, and Palm Beach County to really give people hands-on training so they can be successful in administering your funds. I actually think it lowers the risk of your grant making to invest in them having, you know, sound business practices for HR and financial management, and, you know, by all means, being in the right place with the IRS so they don't lose their 501c3.
Yes. Yeah, no, that's great. And that is something that we have been thinking about and sort of looking into in particular with some of our work around racial equity and some of the grant making that we're going to do there. And it comes back to being, you know, sort of partners with the organizations that share our desire to hit goals and metrics and the doing whatever it takes. So, you know, if there were a partner that we thought would be phenomenal and really knew they've shared the vision and we're going to really be able to do the metrics, if only, then we look at the if only, right? And yeah, so
Worth doing though.
Great.
All right.
Hey, Betsy, I have a question.
Mm-hmm.
I was wondering if Dogwood Trust has developed a strategic plan.
So no, we don't have a strategic plan as such, and that's kind of what we're in the process of doing right now. There is, I think the board did do an original strategic plan. And then right now, those 4 areas, those 4 investment areas, I mean, that probably would be the equivalent of the strategic planning. So we've got, essentially, if you think of it as like 4 strategic plans at once, right? So one for education, and one for housing, and one for health access, and one for education. So
Great,
yeah.
thank you.
Yeah. Great. Any other questions for me or for Dr. Mitchell, who really is your local health hero? I applaud that statement a million times.
He is a true treasure to this community. He is just exceptional in every way, and a very, very caring and dedicated physician. We're so very lucky to have him.